Hi, Dr. Tortland here. In recent years, there's been a phenomenal increase in the interest in various regenerative medicine treatments, including stem cell treatments. And as a result, a lot of clinics are popping up all over the place, purportedly offering stem cell treatments and regenerative medicine treatments. What I'd like to do in this brief video is give you some pointers on questions to ask when trying to choose a provider for your regenerative medicine or stem cell treatment. After all, if you're going to be spending the money, you want to try to get some assurance that you're getting the best quality care possible. First of all, ask the provider, how long have they been doing these treatments? What's their training? For example, I started doing prolotherapy, which is actually the original regenerative medicine treatment, in 1995. I started doing PRP, platelet-rich plasma treatments, in 2007, the first in New England to do so and among the first in the country. I started doing bone marrow and stem cell treatments in 2008 and 2009 respectively. Again, the first in New England and among the first in the country. That gives me a tremendous amount of experience. And not only have I been doing it a long time, but I actually teach these treatments around the country at various courses. Ask your provider what kind of experience they have. How long have they been doing it? In addition, you also want to know, how are they administering the treatments? You could have the best product in the world, but if it's not administered safely and accurately, at the very least you could be wasting your money and not get the desired results. And at the worst, you could actually suffer significant injury. All of our treatments in our office are done under ultrasound guidance, and in some cases where appropriate, we use X-ray guidance. In fact, behind me is an X-ray machine specifically for that purpose. I've been doing ultrasound for 14 years and teaching it for 13 years. I'm registered in musculoskeletal ultrasound, and I'm an international expert in it. I teach ultrasound around the country, and I've published videos on how to do ultrasound. In my opinion, if you're going to be spending the money to have these treatments done, at the very least they should be administered accurately. Ask your provider if they use ultrasound. And if they do, ask them how long they've been doing it. How many courses have they taken? Ask to see the certificates or see their CV. You want to know the level of skill and experience of the person who's going to be sticking a needle in you. In our office, we take these things very, very seriously. And we're concerned because we see an increasing number of clinics popping up with providers who have absolutely no training at all in regenerative medicine offering these treatments. And it's concerning because, in my opinion, they're taking advantage of the lack of knowledge and the desperation of people in pain. And they're offering to do treatments such as stem cell treatments derived from products that contain absolutely no stem cells. So that's the other thing you want to ask. What type of product are you injecting and where does it come from? In the United States, the only FDA-cleared source for stem cells is from your own body, either from bone marrow or from fat. There is no FDA-cleared product that's derived from amniotic fluid, placenta tissue, or umbilical cord blood that contains any live viable stem cells. None, zero, nada. So if there's a clinic out there that's telling you that they're going to do a stem cell treatment using a product that they pull off the shelf, be very wary, because no such product exists. These are the questions that you need to ask. Tell me about your experience and skill. Tell me about your ability to deliver this product accurately, and tell me what this product is. If I seem somewhat passionate about this, it's because oftentimes we see patients who have been to other providers and other clinics, who have received ostensibly stem cell treatments or PRP, in some cases even under ultrasound guidance, and they didn't get the desired results. And that's because the person providing the treatment was inexperienced, unskilled, or injecting, in my opinion, a bogus product. And it pains me to see patients spend money to be treated inadequately or poorly. And then they come to us and we have the unenviable task of telling them that the treatment they got was not the treatment that they paid for. So if you have any questions about whether your particular injury is something amenable to what we have to offer. Or if you have any questions about any of the treatments that we offer, give us a call. We'd be happy to chat with you.